Does vaping really help quit smoking, or is it a gateway to a new generation of nicotine dependency? The question has been at the tip of a global debate for quite some time now. Australia, in particular, has taken a stern stance. Cast your minds back to 2021, when it became illegal for any Australian to purchase or import e-cigarettes or nicotine vapes without a doctor's prescription. Despite this restriction, the addiction rates have continued to skyrocket. A study from the University of Sydney highlighted that over a quarter of teenagers aged between 14 and 17 had vaped. It's not just about the numbers, but the ease of access too. Australia's Cancer Council charity found that 9 out of 10 teenagers in the same age group found it easy to access nicotine vapes. Fast forward to the present day, Australia is once again making headlines, this time with a more stringent regulation. The Federal Health Minister, Mark Butler, who is leading the ban, announced that Australia will ban imports of disposable vapes from January. The intention is clear: to curb nicotine addiction in children and phase out recreational vaping completely. But why this sudden shift in focus? Well, it's not that sudden. In May, the Australian government had signalled its intention to phase out the use of single-use vapes, but until now, it had provided no concrete timeline. Now, the timeline is set. The import ban on disposable vapes will start on the 1st of January, and by March, refillable non-therapeutic vapes will also be banned from entering the country. What does this mean for the industry? Importers and manufacturers supplying therapeutic vapes will also have to comply with tighter government regulation concerning the flavors, nicotine levels, and packaging of their products. But the question remains, is vaping harmful? While experts warn that not enough is known yet about the long-term impacts of vaping, research from Johns Hopkins University has linked the practice to chronic lung disease and asthma. In Australia, scientists who have studied the liquids used in vapes have warned that they contain a suite of chemicals known to impact lung health. Australia's announcement comes just days after New Zealand's government scrapped its world-leading smoking ban to pay for tax cuts. It's a clear indication of the contrasting approaches nations are taking to tackle the smoking and vaping issue. In conclusion, the key points to remember are Australia's new law banning the import of disposable vapes from January, the phasing out of single-use vapes, and the continuing debate on the health impacts of vaping. It's a significant shift in policy and a clear message to the world about the potential dangers of vaping, particularly among the youth. The unfolding story of vaping regulations in Australia serves as a reminder that the debate on nicotine addiction and its impacts on health is far from over.